Breast pain. It is a popular belief that breast pain is related to cancer, and this makes many women worried. However, the truth is that most cases of breast pain are not associated with cancer. Because of this, you should be aware of the other reasons which cause pain in your breasts. In general, women at some point in their life tend to experience breast pain. This is because breast pain is a common symptom of hormonal changes from pregnancy or menstruation. In most cases, women experience inflammation and sensitivity in the breasts or during their period. This is not linked to anything serious. It can simply be a sign of a hormonal change. If there are no abnormalities when doing a self-breast test, but you still experience frequent and intense breast pain, there is a possibility that other benign diseases have an influence on it. Below you will find out the most common causes of breast pain. 1. Hormonal causes. Generally speaking, once teenagers get their first menstrual cycle, they experience a certain pain in the breast. PMS may cause pain before getting your menstruation. A lot of women experience breast pain during their fertile years. The pain is more frequent through their menstrual cycle, and occurs simultaneously with ovulation and the days before menstruation. These two cycle phases occur with a sudden change in feminine hormone levels. Other factors that have an influence on this problem include the use of anti-contraceptive pills and hormone replacement therapy. 2. Pregnancy. Breast pain is one of the first symptoms of pregnancy. A woman that is pregnant at a young age or is pregnant for the first time tends to experience more sensitivity. In most cases, during the first trimester of pregnancy, women experience pain. They have visible blue veins that are a sign of an increase in blood flow and their breasts grow in size. 3. Breastfeeding. Those women that just had a child will experience breast pain, regardless if they chose to breastfeed or not. This happens because of the increase in milk. However, you should be very careful. If the pain is frequent and intense, it may be a sign of mastitis, infection in the breast, usually caused by bacteria, virus, or fungus. Pain, fever, and reddening in the breasts are the most common symptoms. 4. Mastitis. This problem is an inflammation of the breasts, which comes from the obstruction of the milk ducts. This happens due to an infection in the breast, caused by a virus, bacteria, or fungus. The first symptoms of breast infection are pain, swelling, redness and tenderness. You may start to feel unwell, almost as if you have the flu with a raised temperature, general aches and pains and a headache. 5. Cysts in the breasts. Breast cysts form inside the breasts. They are a type of sac filled with liquid and occur when normal mammary glands increase in size. These cysts are benign and are characterized by producing pain in the breasts. When they get bigger in size, you can feel them by touching them. However, some of them require a sonogram or mammogram to be detected. 6. Abscesses in the breasts. Breast abscesses are known as accumulations of pus in the mammary tissue. To be more specific, it is an infection. This problem can lead to breast pain. It usually occurs as a result of bacteria that enter the breasts through cracks in the nipples or from breastfeeding problem. The best thing you should do is visit your doctor and get the proper treatment. 7. Breast cancer. As we said before, many women think that breast pain is related to breast cancer. In general, this is not the case. If you are suffering from breast cancer, breast pain is one of the symptoms that take the longest to appear. If a woman notices any abnormalities in her breasts and treats it on time, she will not feel any breast pain from cancer. Recommendations for preventing and treating breast pain. You do not have to take medicine to relieve your breast pain. Keep in mind that making some lifestyle changes can significantly treat and prevent this problem. Make sure not to wear too small bras. Your diet should be low in fat and rich in fruits, vegetables, and grains. To stabilize hormone levels, you should keep a balanced weight. Increase your intake of vitamin B1, thiamine, vitamin B6, pyridoxine, and vitamin A. Apply some home remedies like water, vinegar, lemon juice, or coffee compresses.